Ryder about duodenal jejunal bypass liner treatment for type 2 diabetes and obesity, glycemic cardiovascular risk factor improvements versus risks in patients treated worldwide.
Okay, thank you very much. These are my disclosures, and I'm talking about EndoBarrier, and this is a picture of an EndoBarrier. I'm holding one up here, and it's a 60 centimeter impermeable sleeve which is implanted during a simple endoscopy procedure into the first part of the small intestine, such that the food passes through the sleeve rather than the small intestine, and it mimics the bypass bit of the Rouen-Y gastric bypass bariatric procedure. Over 3,000 EndoBarriers were implanted worldwide up until November 2017, when the CE mark was suspended. The device is left in place for up to 1 year and has been shown to improve weight and the hemoglobin A1C in people with type 2 diabetes and obesity. During 2017, an independent, secure online registry was established under the auspices of the Association of British Clinical Diabetologists for the collection of EndoBarrier safety and efficacy data from patients all over the world. As of March 2022, data had been submitted on 1,022 patients, i.e. about a third of the patients who ever have received EndoBarrier, from 34 centres in 10 countries: Australia, Austria, Brazil, Czech Republic, England, Germany, Israel, Netherlands, Scotland, and Slovenia. These were the baseline demographics of those 1,022 patients. And I point out in particular the BMI across the world at 41.1 kilograms per meter squared, and also that in the registry only about 85% of them had diabetes, so some people around the world received EndoBarriers even though they didn't have diabetes, just for obesity. And these were the changes in weight, hemoglobin A1C, systolic blood pressure and cholesterol, and you can see they all improved. 13.3 mean kilogram weight loss, and the hemoglobin A1C dropped from 66.7 to 53.9, a 30.7 millimoles per mole drop, or a 1.3% drop. But of course, bearing in mind that many of these patients didn't have diabetes and some weren't particularly poorly controlled, if you look at the hemoglobin A1C response according to the baseline hemoglobin A1C, you can see the higher the hemoglobin A1C, the bigger the response, such that if the hemoglobin A1C is greater than 86 millimoles per mole, the drop is 34.9, or if we look at it in percentage terms, if it's greater than 10%, the drop is 3.2%. Obviously, serious adverse events are important, and the rate of serious adverse events was 4.2%, and I point out that 2.3% of those, about half of them were GI bleeds, and in particular, the liver abscess rate was 1.1%, and that contrasts very much with the 3.5% rate that was reported in the US pivotal study that caused that study to be suspended, and is probably the main cause of problems for EndoBarrier. And we believe that if you look at data across the world, the 1.1% is probably a truer reflection of what it is. There were also less serious adverse events, and these were basically things like early removal because of gastrointestinal symptoms or migration or line obstruction, or precautionary hospitalization for GI symptoms. And even though that was a 13.6% rate, it wasn't necessarily a real problem. For instance, this lady here in the registry, one of my patients, you see her starting off with a BMI of 43.8. She lost about 20 kilograms. Her insulin requirement dropped considerably, and the hemoglobin A1C, you can see, reduced from 9% to 6.4%. And though the EndoBarrier is removed at 6 months because of pain and was found to have migrated, nevertheless she experienced considerable benefit from the 6 months with EndoBarrier and would strongly recommend it. and this is her at 4 years, no longer requiring insulin with a hemoglobin A1C of 7.1%. So in summary, the mean weight loss during the period of EndoBarrier implantation across the world was 13.3 kilograms, with improvements in glycemic control, blood pressure and cholesterol. The higher the hemoglobin A1C, the greater the fall, with a mean fall of 3.2% if the hemoglobin A1 started greater than 10%. The serious adverse event rate was 4.2%, with the majority of these being gastrointestinal bleeds. The rate of early removal for hepatic abscess, 1.1%, was noticeably less than the 3.5% rate in the US pivotal trial, and all patients with serious adverse events made a full recovery, and most experienced considerable benefit from the treatment despite the adverse event. So in conclusion, the effects of EndoBarrier therapy on glycemic control, weight, blood pressure and cholesterol are likely to reduce both the microvascular and macrovascular complications of EndoBarrier, and this international data from the worldwide EndoBarrier Registry suggests that the likely benefits of EndoBarrier treatment outweigh the risks. And I'd just like to share with you a few real patients. So this patient before with a BMI of 33.6 and a very high alanine aminotransferase indicating fatty liver, and this is what happened with the EndoBarrier treatment. Her alanine aminotransferase normalized, her body mass index normalized, and the hemoglobin A1C you see dropped from 8.6% to 6.8%, and at 4 years she's maintained the improvement. This is improvement in fatty liver. This lady, you can see her BMI was 35, she was on 120 units of insulin, and she had obstructive sleep apnea requiring CPAP, and you can imagine what it's like having to wear one of those masks every night when you sleep. She lost over 20 kilograms, her insulin requirement dropped, and she no longer required the CPAP, so she was very happy about that. And at 3 years, she's on hardly any insulin, and she remains off the CPAP. So that's obstructive sleep apnea being improved. This lady on a lot of insulin with a raised creatinine and low EGFR had no longer required insulin after 20 kilograms of weight loss, and her renal function improved, and at 2 years her renal function remains improved, and the hemoglobin A1C is 6.7%. And finally, as that's renal function improved, and this gentleman, hemoglobin A1C of 9.2%, a BMI of 35, and 100 units of insulin. He lost 25 kilograms, hemoglobin A1C normalized, no longer requires insulin, and you can see here that he has a normal hemoglobin A1C and he remains off insulin. Thank you very much.
Thank you very much. One or two quick questions. Please, number 2.
Hello, thank you very much for an excellent presentation. I work in the UK, my name is Fania Kavura. Can I ask you, can you make any speculations? How do these patients manage to retain the weight loss 4 years down the line? What does the EndoBarrier do, or is it just simply lifestyle changes?
Well, I can only talk about my patients, and these were all patients who'd had obesity and poor glycemic control for many years, despite everything that we could throw at them. There are multiple medications, GLP-1 receptor agonists, SGLT2 inhibitors, diet and lifestyle advice, and they couldn't break the cycle, of basically getting their weight down and keeping it down. And I think the EndoBarrier facilitated a considerable weight loss, and they felt so great about having this happen to them, their new self, weighing 2 or 3 stone less and feeling all this energy and the diabetes control better and coming off insulin, that they basically broke the vicious cycles that had kept them in this state. And a lot of them were able to basically, about 3/4 in my experience, were able to just maintain the improvement because they didn't want to go back there because they hated where they'd been.
Number 1.
Holger Sjöholm, Sweden. What do you think with the mechanisms for the beneficial effects of this device? Do you think it simply caloric restriction, or is GLP-1 involved somehow?
I mean, I think that question basically boils down to is how does the Rule 1 bariatric procedure work? And I think there's a lot of studies and information, and I don't have a simple explanation. There are multiple reasons why it should work, including incretins. Basically, the answer is I don't know.
Thank you.
Number 4.
Martin Ozi, Czech Republic. Very nice data. I was wondering, I'm here on your left.
Oh, yeah, okay.
I was wondering, is there any future for EndoBarrier after losing CE mark? Is there anything similar that could be used in the clinical practice later on? Because it was a great device. I mean, we have some
Absolutely.
with that.
Well, basically, there's a new US pivotal study going in America, and there's a new application for restoration for the CE mark occurring at the moment with a lot of hope that it will be restored. And that's why I think it's important I present all this information, because if it does come back again, it will be great.
Thank you. Just one last question from me.
Yes.
You showed the stories of successes, yes, those patients who lost weight and then it was really maintained, which is quite fascinating. Were there any non-responders among this 1,000 people who just lost a kilo or 2 or even gained? It sometimes happens with weight loss procedures.
I mostly know my own patients, and basically something like 25% of them do deteriorate back to where they started. And we found in a lot of those they had problems in their lives, bereavement, depression, medical problems, and basically such that I think they no longer bothered, keep maintaining the situation wasn't as great. So I think the answer is not everybody responds, but a majority seem to be able to.
Okay, and thanks for bringing the device here. You may show it again to those who hasn't seen it ever. Next time you come to the sessions, please show us how you implant it. That would be even more interesting. Okay, thank you very much for your attendance. Exciting session.